Hi everyone, my name is Corey Stackhouse and welcome to today's video where we're going to actually go through an in-depth guide on Medicare. Now we're going to start with the basics for those who are new to Medicare. We're going to dive into the specifics of each Medicare part, and then we're going to explore upcoming changes for the 2024 calendar year. Bonus, I do love fun facts, so I've included those throughout this presentation. We're also at the end going to discuss the options that are available to you in determining what plans are going to be best suitable for your situation. So let's dive in. All right, so first, what is Medicare? Medicare is a federal health insurance program designed primarily for individuals who are 65 and older. It consists of many different parts. You've got your Part A, your Part B, Part C, Part D, and a bunch of other letters within the alphabet, which we'll get into here in another upcoming slide. There are specific enrollment windows available to you. For example, Medicare, whenever you first turn 65, you've got a 7-month window there, either 3 months before, the month of, or 3 months after your birthday month, that you have an initial enrollment period offered available to anybody for the first time signing up for Medicare. In the event that you already are on Medicare, you've got an open enrollment window coming up. At this recording, it's October 9th. So here next week, October 15th to December 7th is the annual enrollment period for Medicare supplement policies and Medicare sign-up period. And then lastly, you've got your Medicare Advantage open enrollment period from January 1st until March 31st. Another thing you might want to take into consideration is that there are late enrollment penalties, which we will hit on a little bit further within this video if you don't get signed up whenever you first initially are eligible. Now, if you are still working with an employer after the age of 65, that's the most common situation where you don't have to sign up for Medicare when you first are qualified to do so because you got offered group coverage by your employer. Fun facts, the first president for Harry S. Truman and President Lyndon B. Johnson were the individuals who signed Medicare into place back in 1965. And actually, Harry S. Truman was the first Medicare beneficiary. So the first letter of the alphabet, Medicare Part A. What is Medicare Part A? It covers hospital stays, skilled nursing care, hospice care, and some other health care too. For most individuals in the US, if you have worked more than 10 years or 40 quarters, you're not going to have any annual premium that you're going to have to pay for Part A coverage. Item to note, it does not cover long-term care or custodial care, which I know some individuals are under the impression maybe it does. There is an annual deductible for this. In 2023, it was $1,600. It's expected to increase to $1,652 for each benefit period. For each benefit period, that's going to be a 60-day window. So if you have a claim on January 1st and then 3 months later you have another claim, you would have another deductible that you would have to meet if we're talking about Medicare Part A coverage alone. It is going to cover the first 3 pints of blood each calendar year covered underneath that Medicare Part A coverage. And then fun facts, in the event you are not one who qualified for Medicare Part A with your 10 working years, you can purchase Part A, but it could cost you up to $499 per month as of 2023, expected to go up in 2024 as well. What is Medicare Part B? Part B covers doctor's visits, your outpatient care, your medical supplies, and your preventative services. So there was a standard premium in 2023 of $164.90 per month. However, in 2024, that is expected to go up about 6%. I've seen ranges anywhere from $174.80 a month or as high as $179.80 a month. Please note, whenever you're talking about any Medicare coverage, Medicare is going to cover 80% of the overall cost of the procedure. The other 20% is going to be on you. Again, if you're talking about your Part A or your Part B Medicare coverages. The deductible for Part B was $226 in the year of 2023, and we expect that to go up to around $240 in 2024. Other things that Medicare Part B covers, it does cover mental health. It'll cover some outpatient mental health services, including therapy and counseling. It does cover clinical research studies in some cases as well to see what's going to work best for you. There are 2 fun facts on Part B that I'm going to share with you as well. If you don't sign up for Part B, there is a late enrollment penalty that I alluded to earlier in this video. It's actually 10% per calendar year that you are delayed for a lifetime increase of your premium. So for example, if you were 1 year late in the year of 2024, for example, if your premium was going to be $174 a month, you would expect that to go up by $17.40 a month, give or take, with my math and rounding error here, for life. So something to strongly take into consideration if you've not already signed up and you are currently eligible. Fun fact number 2, If you make too much money during your retirement years, you actually could potentially have an increase in the cost to you as well. If you make over $102,500 or $205,000 married filing jointly in the year of 2024, for example, your premium is expected to cost you not $175 a month, but $245 a month. And there are income brackets that go up and up and up, all the way up to $500,000 per year where it maxes out for you. Part C, or Medicare Advantage, is the next letter we're going to discuss. It is an alternative to original Medicare. So if you do decide to go with a Medicare Advantage plan, you're actually taking yourself off of original Medicare. Something to note or take into consideration. It is offered by private insurance companies and approved by Medicare, though. Some of these plans are going to offer some additional perks that you would not see inside of a Medicare supplement policy, which I'll hit on here in a later slide. But that's going to include dental, vision, and hearing services that you would not expect to get from Medicare. So that could be a big implication for your long-term expenses if you think about from age 65 until death. If you're saving yourself $100 a month by having a Medicare Advantage plan versus a supplement plan and having to go out and buy the extra dental and vision and hearing coverages, it can be impactful. Now, on a Medicare Advantage plan, there are network restrictions most of the time. So if you decided to use somebody that was outside of the plan's network, you might have to pay higher cost for that service. There are some special needs plans as well. The Medicare Advantage plan is going to be tailored towards specific groups of people, people who qualify for Medicare and Medicaid, if they live in a nursing home, or if they have certain chronic medical conditions. Those are all going to be special needs plans available inside of Medicare Advantage as well. Fun facts, there are some $0 premium plans out there right now. That's what most of my clients that work with me decide to go with if they go with a Medicare Advantage plan, in addition to offering the dental and vision and hearing versus a supplement setup in Part D to set up, which we'll get to here in the next slide. Also, it is essential to review your plans annually. You can change these plans annually. There's no pre-existing condition clauses. That would be another fun fact that I could share with you on Medicare Advantage. What is Medicare Part D? Well, Part D is going to be your prescription drug plan. It's going to be offered by private insurance companies, and it is very important that you enroll on time for this coverage when you are first eligible. There is a 1% per month premium increase on your out-of-pocket cost for the prescription drug plan for life for every month that you decide to wait on your enrollment, which can stack up some big dollars if you think about it over the long haul. There is a drug formulary on these plans. It's going to be a list of drugs that the plan would cover in the event you submitted a claim to them for those particular drugs. So it makes sense to do an annual review on this type of policy as well to make sure the plan that you have chosen is going to be suitable based on your current drug needs. There is a coverage gap that people are or are not aware of, just depends on your situation. It's referred to as the donut hole. It's going to be a temporary limit on what the drug plan will cover until you reach a catastrophic level, and then the plan is going to take care of what it needs to thereafter. Uncommon fact on Part D is actually if you make too much income, you could see a premium increase on this type of policy as well. So those same numbers on Part B that I had mentioned earlier, if you make over $102,500 as an individual or $205,000 married filing jointly, your next increase on your premium would be another $12.90 from what the plan is that you're paying for as well. So fun fact, if you make too much income throughout your retirement years, you could have an increase on your premium cost for your Part D coverage as well. Medicare supplement plans. So this is the other side of the coin from Medicare Advantage plans. These policies are designed to cover coverage gaps in the original Medicare. Benefits are going to vary by policy, but generally all of the coverage offered from those supplement policies has to be the same across the board with other carriers and offer the same basic coverages whenever somebody's purchasing one of these. On average in 2023, the cost was $150 a month for somebody who is purchasing a Plan G policy, if that gives you a reference for the cost. These are standardized policies, as I mentioned earlier, regardless of whether you went with a United Healthcare or Humana or Cigna or Aetna or any of the other insurance carriers out there, all the basic coverages have to be offered the same level of coverage relative to one another. There may just be some extra perks inside of the policies depending on the carrier that you go with. Medicare supplement policies are also going to cover you on foreign travel. Most of them do. Plan Gs do most of the time. Now, it's not going to be an unlimited amount. In the past, I've seen $50,000 of coverage in the event you are overseas or outside of the United States. Fun fact about Medicare supplement policies. They do not cover long-term care, vision, dental, or hearing either. So I mentioned in Medicare Advantage policies, you could have some of those perks included inside of that policy premium that you're paying every month, which could be a zero policy. Or if you were to go a Medicare supplement route and purchase a prescription drug plan, you would need to go out and purchase any dental, vision, or hearing policies that are going to be useful for you as well. Upcoming changes for the 2024 calendar year between Medicare Advantage plans and the other stuff that we've got going on. There is a 6% annual cap that is going to be enforced in the year of 2024 and 2023 for premium increases on those policies. In short, it means that the policy cannot exceed 6% annually during this policy period from years 2024 to 2030. So you should not see a big giant 20% increase in cover or in cost, for example, on your Medicare Advantage plan. Now, Medicare Advantage benefits, they are going to have some extra enhancements. In 2024, they're going to extend some additional coverages in the area of dental, vision, hearing, and they're going to provide some better telehealth services to individuals as well. Their goal is to aim to provide enrollees with more comprehensive coverage options, because the goal is to get more people on Medicare Advantage plan, at least is what it seems based on my research and findings. The enrollment options and plan selections, you will have more options than what you did have the previous year. So item to note, it means that you're going to have more robust coverage offered available to you, and it might mean a smoother transition if you needed to change from one carrier to the other. Some additional changes in 2024 are going to include a 6% projected rise on the Medicare cost, as we kind of alluded to for Part B earlier. So it's kind of a double piece of information, but expect your cost to go up on your Part B premium to at least $174.80 a month as expected. The main reason for this is income distribution, and there's new treatments like Alzheimer's medication that is costing the government more. So those prices are going to be passed along to you through the Medicare plans that you have. Part D changes. The enrollees are now going to cover 20% of the total drug cost during that catastrophic phase I alluded to earlier versus 15. That means that you could have potentially higher out-of-pocket cost on your prescription drugs in 2024, although there is an Inflation Reduction Act that is going to impact things over the long haul. Once a Medicare Part D prescription drug enrollee reaches the catastrophic level in 2024, they will no longer have out-of-pocket costs for those drugs. So that 20% is going to come into play prior to reaching the catastrophic level. And then once you get there, you're not going to have any additional out-of-pocket cost. By 2025, the goal is to actually have the maximum out-of-pocket cost for prescription drug plans be set at $2,000. Versus right now, it's much higher. I want to say it's in the $4,500 or $5,000 range currently. The next question is, how do we choose the right plan for you? Well, you generally have two options. You can go to the Medicare.gov resource that is offered to you, or you can find an independent agent to help you through the process. So here are a couple advantages and disadvantages of both. A few advantages of using the Medicare.gov resource is it's going to be a comprehensive database. You're going to have all the insurance options available to you within that portal, and you're going to have the most updated information available on that portal to you as well. Some disadvantage, though, is since there are many options to choose from, it could be a little overwhelming at times. You also have a call center available to you, but note that the representative is just going to provide you some generic information. They're not going to actually have plan specifics or details like how an independent agent would. And it could be time consuming doing all the research on your own. So here is some advantages and disadvantages of working with an independent agent versus going to the Medicare.gov resource. The first advantage is you're going to have tailored guidance. You're going to have an agent that's going to be helping you find the best plan based off of your health needs and your financial situation, not just preparing you the basic information that Medicare.gov would. It could save you a lot of time, because as long as you are able to provide the agent what they are requesting, they're going to be able to do a lot of the legwork and put a few plans in front of you that might be suitable for your situation. You're also going to have some expertise that's built in with independent agents. So my agency, like myself, we've been doing it a few years now, so we're appointed in lots and lots of states. With that, we've developed a vast knowledge of what types of plans are good versus others that maybe are not so good relative to the client base that we work with and the experience and the input that we get from those clients. Now, the disadvantages you may come across with working with an independent agent would be you might have limited options. So an agent may or may not sell all of the same policies that are offered in your area based off of maybe the commissions are going to be different based off of the policies, or maybe they just do not have an appointment with those particular carriers that you may or may not be interested in. Also, there could be potential bias in the world of Medicare. If an agent guides you towards one plan or the other, I would actually suggest you question why they are doing so, because there could be a difference in commissions that they might get paid more on one policy or the other that you want to take into consideration. Okay, so that was a lot of information very quickly, but in conclusion, understanding Medicare is crucial in making informed decisions about your health care. It can help you determine what plans are going to be best for you based on your needs. It's also going to help impact your financial situation, so your retirement income plan. If you're able to save money over here or spend less over there based off of finding the most appropriate plans for you, it's obviously going to help your bottom dollar at the end of the day. So I hope you found value in this video. If you did, please consider liking the video and sharing the video with anybody who could benefit from the information that was described inside of this video. If you are interested in talking with an independent agent who has an unbiased opinion on what plans are going to be best for you, please feel free to reach out to our office. Our contact information will be in the description below. Otherwise, thank you for your time. I hope you have a wonderful day. Thanks.